So what you have here are the contents of the bandage kits that we send home in our equine bandage kit. So the first thing you'll have is your non-stick dressing. You also will get a pack of gauze sponges, a small roll of gauze, a sheet cotton, a brown gauze, a vet wrap, and an elasticon. So when you go to apply your bandage, you want to try to avoid touching the bandage material as much as you can, so opening it cleanly. The first areas or layers of the bandage that you'll need will be your non-stick bandage that'll go directly against the wound or the sutures, the 4x4s to go behind that, and the roll gauze. So using just a corner, you can lift the sterile gauze and place it on your gauze pad, but again, try not to touch the middle where it's going to be against the horse's skin. This can then be taken gently out of the tray by the corner again to avoid touching the center. If your horse needs to go home with a bandage over their carpus or their knee, the first step of your bandage will be your non-stick gauze or your adaptic, followed by a stack of sterile 4x4s. This should be placed over the wound or the surgical site and held in place with your sterile roll gauze or your cling. With the carpus, it's important to apply this snugly enough to hold your gauze in place, but not tightly, and we want to make a figure-8 pattern so that you do not directly overlap with the accessory carpal bone, which is the bone that protrudes out from the back of the knee. So as you work your way down, again, you can use this figure-8 pattern in order to avoid putting excess pressure on that bone. When you've reached the end of this roll, you can tuck the end in to keep it in place while you get ready to apply your next layer. So once your roll gauze part is on, the next step will be the sheet cotton. This will come in this blue outer casing to keep the sheet cotton sterile. As you open it again, you want to not touch it excessively, although it's okay to touch it to some extent as you're going. So the sheet cotton will be held in place with the brown gauze. That comes in this paper tube. You can pull that out, and then you'll take your sheet cotton to apply to the limb. Your next layer will be your sheet cotton. You want to center this over the carpus and place it with even pressure. Your sheet cotton is held in place with your brown gauze. With your brown gauze, you want to apply it starting at the top, but leaving out about an inch of your sheet cotton, so to avoid having the brown gauze directly on the skin. This should be applied with firm, even pressure and about 50% overlap between each layer. Again, at the bottom, you want to ensure you leave a small amount of sheet cotton poking out. And as always, make sure you're wrapping in the same direction with each layer of your wrap. And once you've reached the end of this roll, you can again tuck the end in to hold it in place. The next layer of your bandage will be your vet wrap, which is stretchy and will stick to itself. This should be applied directly over the brown gauze with firm, even pressure. With each layer, you want an approximate 50% overlap, and you can stretch it to the point where the wrinkliness is a little less as you go. At the bottom, again, you do not want to go past your brown gauze to make sure that there's a little sheet cotton out. Boy. The final layer of your bandage is your elasticon, which is an elastic and adhesive bandage material. Approximately 50% should be placed on your bandage and the other half on the patient's skin. This should be applied loosely, as it is possible to apply it too tightly. Once you've applied it, 1 or 2 times around the limb, it can be cut off. And this should be applied at both the top and the bottom of the bandage to help prevent the bandage from slipping, as well as dirt or debris from getting into your bandage. It is sometimes helpful to pre-stretch it before applying it to the horse. Again, at the bottom, we want 50% on the bandage and 50% on the patient. The final step for your carpal bandage is to ensure there's not excess tension on the accessory carpal bone. In order to do this, we'll make a small cut in the back of the bandage that extends through the vet wrap and the brown gauze. You can do this with either a scalpel blade like we do here or a pair of scissors. A small cut is made that extends, again, through both the vet wrap and the brown gauze so you can see your white bandage material underneath. Once you've made this, you can overlay this small hole in your bandage with a small piece of elasticon in order to prevent any dirt from working its way into the bandage. At this point, the carpal bandage is complete.